So, good evening, class. I wanted to try to make this video to help you with the treatment planning homework that is due this coming Sunday, March 22nd, and to also possibly review some ideas and concepts that were included on the last homework assignment that's already been graded. So, this is from homework number 3 for treatment planning. So, in case number 1, we're looking at a patient who's been treated on the Cobalt machine using SSD technique at 80 cm to the thoracic spine where the patient is prone. We're going to use a single treatment port, and the collimator setting is a 10 by 10, and there are no blocks. The prescription is given as 3,000 centigrade, and we're going to deliver that 3,000 to a depth of 5 cm in 10 fractions. And the task is to calculate the treatment time. So I've put together a diagram here of the patient who's prone on the table. Here's the treatment port coming in on the posterior aspect of the patient. Here is a PA view, so we can see what the field would look like on the patient's back, a 10 by 10, 10 by 10. X jaw would be 10, Y jaw would be 10. And we're going to calculate the treatment time. So we need the treatment time formula, and we also need to recognize that this is an SSD technique. So the treatment time formula would look like this. Treatment time, the prescription dose, and then those factors along the bottom, remember? So we're going to have to find the reference dose rate for Cobalt using SSD technique. We're going to need the collimator scatter factor for this 10 by 10, and since the reference dose rate was probably taken with the 10 by 10, the collimator scatter factor is going to be, guess what? 1. Then we're going to need the phantom scatter factor. And then we're going to need any attenuators, but we have no attenuators. There are no blocks. We're going to need percentage depth dose because this is an SSD technique. And then we're going to need the backscatter factor, or what's known as the peak scatter factor for higher energies above 400 kV. So this is what we're looking at for case number 1. This would be our formula. These are all of the factors we need. There are no blocks. We're treating at a true SSD where isocenter is on the patient's skin. So we don't need the inverse square correction. Isocenter is here. SSD is 80 cm. So this would be the formula we need for this one. Okay, now let's take a look at case number 3, which is just a little bit different. So same machine, same technique, single PA. This time, we're using blocks. We have the collimator set at 15 by 15. This is the collimator opening. X would be 15, Y is 15. But then there are blocks that we've created. We've created a shaped field by either cutting a custom block or by putting in standard blocks. So X and Y jaw are 15 by 15, but the block has been cut. So this is the area that's open. This is the area being treated. The area being treated is an 8 by 12. So here's how we're going to consider this blocked field in this similar condition. So this time when we calculate the treatment time, this is going to look like this. The prescription dose on the top. Then we're going to find the reference dose rate. Then we're going to find the collimator scatter, and the collimator scatter is going to be for the collimator setting. And then we're going to find the phantom scatter, except the phantom scatter is going to be for what we call the effective field size. This is the effective field size. Then we're going to need percentage depth dose because this is SSD. And then this time we're going to need an attenuator or transmission factor because there's a 5 millimeter solid plastic tray. I'll let you look this factor up. This is true SSD. Isocenter is here on the skin, so we don't need inverse square correction. So this is how this looks different than the first case. Okay, I'm going to do another video where we can go through field size definition and the difference between SSD and SAD technique.